It's a special delight and a privilege to welcome this morning as the closing talk for the Reimagine series that we commenced almost a month and a half ago. And I'm really delighted to have a dear friend, Dr. James Orbinski, who's the inaugural director of York University's Dahdaleh Institute of Global Health Research. He has worked providing medical, humanitarian relief in situation of war, famine, epidemic, disease, and genocide with Doctors Without Borders. He was elected international president of MSF from 1998 to 2001 and accepted the Nobel Peace Prize awarded to MSF in 1999. James, thank you so very much for making time to speak to us, and the stage is all yours.
Thank you very much, Tenzin. I am just thrilled to be speaking today, and I'm particularly thrilled, Tenzin, that I'm able to offer some thoughts around anticipatory action and global health challenges of the 21st century. As you know, Tenzin, my affiliation with the Dalai Lama Center for Ethics and Transformation at MIT is a long-standing and deeply held affiliation. And I'm just thrilled to again be able to participate in the pedagogy, if you will, or in the offerings of the institute. And so Tenzin has asked me today to talk about anticipatory action in the context of global health, and particularly in the context of the global health challenges of the 21st century. And what I'm going to do is I'm going to talk with you about our approach, or my approach, to addressing global health challenges. It's very much an approach that's rooted in critical problem solving for greater equity, for greater effectiveness, and for excellence in research, policy, and practice as it applies to global health. Over the next 25 minutes or so, I'm going to go from the specific to the general, and then back to the specific again, and constantly try to demonstrate through example what this actually means. All in the broader context of identifying the major factors that are at play today in now the third decade of the 21st century. Pasteur, Louis Pasteur of the mid-19th century is one of the most significant scientists who contributed to our understanding of basic public health and basic clinical medicine, and whose approach to science, observation, careful experimentation led to transformative understandings of germ theory. And in fact, prior to the emergence of germ theory in the mid to late 19th century, the concept of spontaneous generation was really the concept that underlay the idea of disease. That disease just somehow magically happened. And with Pasteur's approach and his scientific approach, that led to the emergence of germ theory, which really basically says that disease, infectious disease especially, occurs not just spontaneously, magically out of the ether or out of a miasma, as it was then called, but it occurs under very specific causes and conditions. And that if one can identify through observation and experimentation those causes and conditions, one can then develop approaches to intervention and approaches to containing, controlling, and mitigating a particular infectious disease. But this concept is a very, very new concept in the relative scope of human history, but it is genuinely revolutionary and has been revolutionary in terms of the emergence of clinical public health and in terms of the emergence and subsequent iterations and generations of scientific and medical and public health knowledge, which now define us or are beginning to find form in their definition in a global context. And so Pasteur made many, many contributions and held many insights, but probably I want to just highlight two. One of the things that he very much recognized, despite his incredible mind and his incredible discipline in understanding the causes and conditions of a particular disease, and in terms of understanding and generating the basic foundational blocks of microbiology, he said that in fact, the microbe is nothing in terms of understanding disease, in terms of understanding the causes and conditions of disease. He said the microbe is nothing. The milieu is everything. The context, the circumstance in which the microbe exists, and the causes and conditions that are at play around that microbe. This is critical to understanding the nature of disease and to understanding when, where, and how one can intervene. It's a very simple insight, but it's very powerful. Pasteur also recognized that chance favors the prepared mind. So in other words, in order to intervene, we don't know exactly when a particular set of causes and conditions will converge to create a particular infectious disease in an individual, in a community, globally. We don't know the exact moments when such things will happen. And we typically call this a chance occurrence. But in fact, if we know that an event is predictable, is it truly and uniquely and only a chance event? Well, in terms of intervention. And so what Pasteur recognized was that if you understand the causes and conditions of a particular disease, then you can predict the occurrence of that disease, and then you can also design interventions, prepare in advance, so that when certain causes and conditions emerge, you can then take appropriate action to mitigate, to adapt against the particular reality of that disease. Now that is a very basic concept, and it tells us a lot about not just causality, but also vulnerability. And when we think about COVID today, I ask a very simple question: who is getting sick with COVID? Well, the majority of people who are getting sick are the people who are the most marginalized, the most vulnerable people in our societies. And this is a picture of a Black American man in New York City, and who very specifically characterizes the highest vulnerability group in the United States for COVID. And there are others, obviously, but I'm just using one example. The same is true globally. It is the most marginalized and the most vulnerable people who are most, not just at risk, but who are actually getting COVID and becoming sick and dying of COVID. So this is part of the causes and conditions of this particular pandemic. And understanding this is really fundamental to understanding intervention and really fundamental to understanding future predictability. Now, Hannah Arendt, excuse me, is my favorite. I have maybe 3 or 4 critical, really treasured philosophers. But Hannah Arendt is probably my favorite philosopher for many reasons. But one of her great insights and great perspectives was recognition that we are not born equal. Equality and equity by extension, equality is the result of human organization. How we see ourselves, how we organize ourselves, how we structure our relationships with each other, how we structure our societies, these are fundamental to defining equality or equity. And in the context of COVID, as I've just said, those people who are most vulnerable are those who are most marginalized, who are treated most inequitably, and who are not included in the formal systems and structures of society. So I said at the outset that I wanted to talk very practically about the kind of things that we do at the Dahdaleh Institute. Well, one of the things that we're doing is we have already developed a series of safe water optimization tools for complex humanitarian emergencies, for situations of famine, war, in context of internal displacement, refugee camps, and so on. What we've done is we've combined three technologies: digital platforms, artificial intelligence, and biosensors and data from biosensors. We combine those three technologies into a tool that allows us to predict the probability of an outbreak of disease, of waterborne disease, which is the highest risk in a refugee camp or IDP or complex humanitarian emergency setting, a highest health risk. We're then able, with this prediction, to prescribe through a mobile phone to a particular mother or father or water and sanitation engineer how much chlorine to put in your bucket or in your 500,000 liter bladder tank to eliminate pathogenic contamination of that water, thereby reducing or eliminating the risk of infectious disease. So that's one. This tool now has been developed, we've tested it, and we're now scaling it and working with a whole range of organizations to bring this into full application in complex humanitarian emergencies. We also have a very elaborate program on COVID public health strategies. And this is now a consortium of York University professors with 50 academics and policymakers in 8 African countries. And these here, I'm listing the countries here, South Africa, all the way through to Nigeria. This is the team that uses artificial intelligence, machine learning, to analyze and understand the causes and conditions of COVID in very particular contexts, very particular African contexts, so that we can make recommendations to policymakers and to health officials on what kind of vaccination strategy will be most effective in your particular setting. This is a highly effective consortium, and we are learning so much, not just about health, but about how to understand complex systems and how to understand and intervene in complex systems so that we can maximize not just COVID policy responses, but general health responses. We're using artificial intelligence and machine learning, and there are many complex explanations of what is artificial intelligence and what is machine learning. Well, essentially, it's a series of multiple convergent correlations between variables. That's essentially what it is. And then reducing each correlation and then recorrelating that correlation with yet another. And then extracting from that the core strength of a particular set of convergent and previously understood variables and the relationships between those variables. And here is a very simple diagram that tries to offer a visual explanation of what I've just said. So what we've been doing, for example, with this consortium is we've been developing dashboards for different countries. And here's an example of recurrent neural network, which is just a concept for doing what I previously described. This is how one applies essentially mathematics and mathematical theory to this idea of to create artificial intelligence. So when you take this concept, you can then create very concrete tools. And so here, for example, is a dashboard of data for South Africa that is structured so that policymakers, policy users can make good decisions. This, for example, is widely used now in South Africa with about 10,000 hits a day. And that's not among the general public, but that's among policymakers, among public health officials and so on. And it's broadly used by specialists. And we were making recommendations to the Ministry of Health, to the President's Office and so on an almost daily basis about how to approach COVID. And we're doing this in 8 additional countries in Africa. And so what this tells us one of the things that this kind of illuminates for us is the complexity of the world in which we now exist. We know, you don't need a crystal ball to know that there are multiple and converging crises and issues globally that demand our attention in terms of understanding and developing appropriate responses. When you think about COVID and complexity, here's a diagram that attempts to visualize the complexity of issues. I certainly don't expect you to look at every particular word, but just look at the colors. The green, economic; the orange, environment; the gray, health services; the purple, health; and the pink, the political structures and the sociology of political structures. All of these can be modeled. All of these can be understood and modeled mathematically. And this is what's called a causal loop diagram of COVID. And what we do then is we essentially parameterize each of these subvariables. And the value of each variable can be changed according to particular circumstances and according to particular understandings. But the point here is that complexity can be understood and it can be modeled, not perfectly, but with each iteration, it gets better and better and better. And this is essentially what we've been doing with COVID for Africa. And we're not the only ones doing this. There are many, many people, many people doing this with great effectiveness. Now that complexity also applies to broader problems, to bigger problems, like, for example, climate change. And what we know very clearly, without going into much of the details, we know that climate change or climate warming is a very real phenomenon. It is happening not in the future, it's happening now. We know that the rate of extreme weather events, if you look at this graph from the lower left-hand quadrant all the way up to the upper right-hand quadrant, we see that there's an upward trajectory of extreme weather events, which are a consequence of meteorologic or climate change. And we know scientifically that, excuse me, even if today we stopped all greenhouse gas emissions, we know that the downstream effects of prior greenhouse gas emissions, the downstream effects mean that we will see an upward trajectory of extreme weather events for at least the next 30 years. So the increase in extreme weather events that we're seeing around the world, floods, hurricanes, wildfire, this is only going to increase, even under the best of circumstances. This is only going to increase over the next 30 years. And excuse me, when we look at projections, sorry, excuse me, I'm just trying to, there we are. When we actually look at projections in terms of global warming, if you look down here, our current policies globally put us not at a global temperature increase of 1.5 degrees, which is what most politicians actually talk about publicly. Our current policies put us in the range of a 2.8 to a 3.2 degree Celsius increase in global temperature by the end of this century. That will mean massive disaster and massive change in terms of the impacts of climate change on human civilizations. And this is under current policies. If we continue to increase our greenhouse gas emissions, which in fact we are doing, we're not actually reducing our greenhouse gas emissions, we're increasing our greenhouse gas emissions in reality, we may very well see a much higher temperature increase, 4.1 to 4.8 degree Celsius. And this is virtually, we have no idea what this will mean for human civilizations around the world. Only that it will be massive, it will invoke massive change in terms of how human beings live, work, and play. And what we also know is that climate change is not just about extreme weather events like floods and droughts and the disasters that are associated with them, but it's also about changes in infectious disease, changes in patterns of infectious disease. And it's also about food insecurity. And we also know that climate change is affecting the poorest countries in the world the most severely. And we can simply conclude that the people who are doing least to cause climate change, or who have done least to cause climate change, are actually the ones who are suffering the most. Let me just give you a very concrete example in Malawi, in Lake Chilwa, where I have a research program with friends and colleagues. We know that in Malawi and in the sub-Saharan African region, that crop yields are projected to decrease by upwards of 50% over the next 70 years, while that could be as much as 90% among small-scale farmers. And we know that in the southern region of Africa, that today millions and millions of people are already on food assistance from the World Food Programme. We also know, I said earlier that climate change is not simply about extreme weather events and crop yields, it's also about infectious disease. We also know that in Malawi, schistosomiasis is a major problem. Schistosomiasis is a waterborne parasitic disease that's transmitted by a snail. And it has a very significant impact in terms of people's health. I'm not going to go through this diagram, but what it does show you is that there is a relationship and a circular, complex relationship between the parasite itself, the sporocytes within the snail that actually cause schistosomiasis, and the environment in which that sporocyte exists and in which human beings exist. And so it's, as I said, it's a waterborne infectious disease. And here you can see, this image, you can see the point of contamination, the point of infection. And so this disease is very much affected by and its causes and conditions are very much affected by meteorologic change and by climate change, by temperature change, by humidity, and also by the ways in which human beings interact with their environment. It also has huge implications for food security. So sick people are less able to properly or to effectively engage in meaningful agricultural practices. Healthy people, on the other hand, are able to engage in meaningful agricultural practices and also are able to change their agricultural practices. So I want to just talk very quickly now about anticipatory action. Well, this image tells us a lot, right? There's a storm coming. It once was a sunny day, but there is a storm coming. So anticipatory action is about understanding the relationship between a particular hazard, i.e. a storm, and vulnerability. So the degree to which a person or a community or a nation or a globe is susceptible or at risk or susceptible to the impacts of that particular hazard. And hazard times vulnerability, this is what defines risk. And we know that if we could, again, identify and model triggers, understand the particular causes and conditions of a particular hazard, we know that we can better understand the ways in which a hazard occurs, the ways in which vulnerabilities increase exposure to a hazard, and therefore we can anticipate and we can engage in action that preempts the impact of that particular hazard and hopefully preempts or reduces the probability of crisis associated with that hazard. And so anticipatory action is about anticipatory adaptation. It's really about changing your behavior so that you can achieve a transformation in your health status or in the health and well-being of your particular community or country. This basic concept, it may seem so elemental, and it is elemental, but this basic concept is now driving the research agenda of OCHA, which is the United Nations Office for the Coordination of Humanitarian Affairs. And this is the office that coordinates all of the UN agencies and humanitarian response. And this very simple idea is actually itself is a revolutionary idea in terms of how we think about humanitarian affairs and humanitarian response and humanitarian action. And let me just give you a very concrete example. I just talked about schistosomiasis, and I talked about some of the variables at play. Well, those variables, just as with COVID, those variables can be modeled and they can be understood, and the nature of their relationships can be modeled and understood. We know that there are ecological services, as we call them, that are a huge variable in understanding the causes and conditions of the disease schistosomiasis. The same is true of the dynamics of infectious diseases themselves. Schistosomiasis has very specific dynamics, just as malaria has very specific dynamics that are slightly different than schistosomiasis. The same is true for agriculture and food security. The practices that one engages in, or that a community or a nation or collectively as human beings we engage in terms of agriculture and food security, these have a direct impact on schistosomiasis. Our approach to clinical public health, our understanding of extreme weather events, and our approach to disaster risk management. All of these things are major variables or subsystems, if you will, that influence schistosomiasis. One can influence directly. Each of them, in fact, are likely to influence directly. Some are stronger than others in terms of their influence. And then each of these subsystems affect each other. So extreme weather events, in fact, affect the dynamic of infectious disease, which affects disaster risk management, and so on. You can close the loop. And the directionality of the relationship can also be different. And then as well, there can be relationships across subsystems that have a convergent impact on our understanding of schistosomiasis. So suddenly a very apparently simple idea, you can see, becomes quite complex. But each of these elements can actually be understood, quantified, and the relationship between each one of these subvariables can actually be modeled. And then applying artificial intelligence, machine learning, big data analysis, we can have a better understanding and a better predictive capacity around schistosomiasis. The same is true of malaria. The same is true of cholera. And the same is true, for example, of malnutrition. And so what we're doing in Malawi is we are applying complex systems theory to 6 subsystems, which I've talked about: ecological services, extreme weather events, infectious disease, food security, disaster risk management, and clinical public health. And we're doing that around 4 very particular diseases: schistosomiasis, cholera, malaria, and malnutrition. And the aim of the project is to design and test simulation tools that can assist community, government, and non-government organizations to adapt effectively to reduce the health impacts of climate change in the Chilliwack Basin. And we're looking at 3 different pathways for intervention: better treatment, better prevention, and better adaptation to achieve improved health outcomes around the 4 target diseases that I've talked about: schistosomiasis, cholera, malaria, and malnutrition. With many partners, University of California, Irvine, Malawi government, LEAD South Africa, the Wellcome Trust, and of course the Dahdaleh Institute. So I've talked a lot about complexity and what that means. Well, let me just illuminate that just a touch more. We know that climate change is increasing people's vulnerability to humanitarian crisis. And we know that the world's 8 worst food crises are all linked to both conflict and to climate shocks. We also know very broadly that the way in which human beings are organizing themselves, that this is changing radically. It's sometimes very difficult to see when you're, unless you take a long view. If we go back to 1500, the year 1500, there existed somewhere between 300 and 500 million people on the planet. Now, 530 years later, 20 years later, we are now 7.6 billion people. We're adding 1 billion people to the planet, adding 1 billion people to the planet every 13 years. That is an exponential increase in human population. We're also, go back to 1500, and you can see on the red graph, the red bit of the curve relative to the blue. Go all the way back to 1500, and you can see that only a very small percentage of human beings lived in cities. In fact, it was less than 3% of the human population lived in cities. Now, it's 55% of human beings live in cities. And by 2030, it will be 60%. Now, that rate of change is massive, and it's exponential, and in terms of urbanization. And people the majority of the world's population do not live in the shiny, gleamy, Wizard of Oz cities of Oz, like Toronto or New York or Paris, or the majority of people in urban settings, between 50 and 75% of people who live in urban settings live in slums, in barrios, and in squatter settlements. And these do not have formal infrastructure. There is infrastructure, it's informal largely, but excuse me, the absence of formal infrastructure means that there's a higher probability, a higher risk of, for example, infectious disease outbreaks. As well, inequality around the world is actually rising. We are certainly at a time in human history where there's more wealth than ever, but that wealth is more and more concentrated in fewer and fewer and fewer and fewer people's hands. And we also know that the degree of inequality in the world actually varies around the world. And what this graph shows you, these different colored lines, they show that for different regions of the world, there are different rates of rising inequality. So India versus Canada and the United States, Russia, China, and Europe. While inequality is actually increasing, as wealth, by the way, is increasing, inequality and access to that wealth is also increasing. There are also differences across regions in the world. And what this tells us is that institutions and policies and the ways in which particular polities, countries, organize themselves have major impacts in terms of inequity. We also know, in terms of broader context, we know that conflict now, war between nations or among nations, is no longer simply interstate, but one nation versus another, and localized. We know now that conflict is regional, it's borderless in terms of its impacts. Borders are porous and the impacts are global. This is an image of people fleeing North Africa trying to get into Europe only 2 or 3 years ago. And that phenomenon continues. In fact, a boat sank in the Mediterranean a number of weeks ago, killing about 50, I believe, children who drowned in exactly these circumstances. And the phenomenon associated with war and now regional conflict is migration, migration of people who are seeking to flee war. And this is a very, very significant phenomenon. It's not simply war, it's also social disruption or social instability. And this is really what's driving the movement of migrants, or so-called migrants, from southern America to the Mexican-American border, and all of the issues that have emerged there around build the wall, don't build the wall, and so on and so on and so on. So there's also a worsening dynamic, if you will, between climate change, fragile states, food insecurity, and emerging and re-emerging infectious diseases. These phenomena are related, and they are interrelated. They are interdependent, and have very specific causes and conditions that can be understood and have very specific impacts, humanitarian impacts. The world has been described as a quote unquote VUCA world. That's an acronym which means volatile, uncertain, complex, and ambiguous. And I think it is actually a very apt description of the world as we are in it now. I won't go through all of the points that are described on the slide, but they are essentially what I have just described. There's a discontinuity with the past. There's an accelerating rate of change, multiple and converging crises, especially in climate and ecology, that urbanization and population are key issues, inequity around access to wealth is egregious and growing, and that the issue of governance, how we make decisions collectively, this is front and center. When we look at global risks, the World Economic Forum puts out an annual global risk report, and it's probably one of the best reports that's publicly available in the world. I don't expect you to look at this in great detail, but what I want you to see here is that its risk analysis, what it does is it essentially identifies a series of risks and it maps them in terms of their impact and in terms of their likelihood. Now, in the upper right-hand quadrant, this is what I want you to focus on. In terms of the likelihood and the impact of risk, the single largest and highest likelihood and highest impact risks are in the upper right-hand quadrant. And 5 of those 10 risks are environmental and ecological. These are the risks that, excuse me, that now accrue and that leave the most vulnerable people at the highest risk. This is a major change for human beings when we speak historically, and this has huge already humanitarian assistance impacts. What we're seeing is again this upward trajectory, a massive increase in the number of people who need humanitarian assistance, and that number is only growing. And this is humanitarian assistance by OCHA, the Office for the Coordination of Humanitarian Affairs. This is by no means the number of people who are in extreme situations. This is a small subset of those people who need direct humanitarian assistance. Now, when we think of people in need, right now, when we go back to COVID, we just think about vaccination. Well, this slide demonstrates where are there extensive vaccination rollout strategies and where are these in progress. What you can see is that largely in the Western world and in some other parts of the world, there are vaccination strategies that are being implemented. There are variations in the degree of success and so on to date, and the degree of effectiveness to date, and they're all at various stages of rollout. But the gray area indicates where there is effectively, and I say effectively, no meaningful vaccination strategy taking place. Well, this is really important because of the nature of COVID. And there is I have to say, really a delusional understanding that somehow being vaccinated is in and of itself a sufficient intervention against COVID. There's also a delusion, I think, that a self-imposed delusion that, for example, the Western world, that we care, right? That we care about others, that we care about inequity, we care about ensuring that all people are treated fairly in terms of health and so on. Well, I actually don't think we do. We know that, for example, in my own country, Canada and then the United Kingdom, that we've purchased enough vaccines to cover 500% of the population of Canada, and in the case of the UK, 300% of their population. Now, how could I possibly use 5 times more vaccine than I actually need? But my country has purchased that volume of vaccine for me, and that purchase has precluded the ability of other countries, the gray zone countries here, to themselves purchase those vaccines. They simply do not have access to the vaccines that we have pre-purchased. And we pre-purchased 500,000 of them, 500% of the available vaccine for our relative population needs. Well, this is just, not only is it egregiously and morally, in my view, wrong, it's also incredibly short-sighted and incredibly delusional in terms of a meaningful response to the reality of COVID. We know that new variants of COVID are emerging. We know that in most cases, there's variable effectiveness of current vaccines to those variants of concern. But we do not know that the current vaccines will be effective against future variants. And we know that there are literally hundreds of thousands of mutations of COVID, if not millions, mutations of COVID occurring every single day, some or a few of which become variants of concern because they affect the human population in a very direct way, with either higher transmissibility or higher morbidity and mortality. We don't know if our current vaccines will be effective against the inevitable future variants of concern that emerge. And so it is absolutely wise self-interest to ensure that every single person is vaccinated, every single person on the planet is vaccinated as quickly as possible. And the reason for that is that vaccination drives down transmissibility. And when you drive down transmissibility, you drive down the probability of mutation and therefore the probability of new variants of concern emerging. So as Dr. Tedros, who is the WHO Director General, very clearly said and very nicely summarized, no one is safe from COVID unless everyone is safe. And this is a very simple, but I think profoundly transformative insight. And if we could just simply get to that point where we understand that my being is possible because we are possible, that I am because we are. This is a concept, the African concept of Ubuntu. And it is a beautiful, beautiful description of the nature of our interdependence. Now, if one likes or prefers Western thinking or Western philosophers, here is one of my other favorite philosophers, Emmanuel Levinas, who really talked and understood that the way we interact with each other, the way we see each other, that this is a dialogue, this is best and most fruitfully a dialogic relationship, not one rooted in utilitarianism or rooted in consequentialism, but rooted in a dialogic seeing of the other, seeing of myself in the other, seeing of the sameness of self in the other, and that this is, in essence, the root experience that is root subjective and intersubjective experience that is the origin of equality, the concept of equality, and the origin of the political form of that, which is human rights. And I think these concepts apply not simply to our relationships to each other as human beings, but more with equal urgency, they also apply to our relationship to our biosphere and to our planet. And with that, I just want to conclude by really challenging us to think about what this means in terms of stories, in terms of how we see ourselves, in terms of how we describe and find ourselves in the stories that we tell ourselves about ourselves. And I wrote a book some years ago called An Imperfect Offering. And I was just flipping through it the other day, and I found this, something that I wrote about 10, whatever it was, 10, 12 years ago. And I think it is a challenge that I'd like to end this little discussion with. I'm going to read it. Stories. We all have stories. We find ourselves in them, we make ourselves in them, and we choose ourselves in them. And if we are the stories that we tell ourselves, we'd better choose them well. I think we are now at a point where we genuinely need a new story, a new way of seeing ourselves in relationship to each other, and a new way of seeing ourselves in relationship to our biosphere and to our planet. And I think this is a critical element to the emergence of global health, genuine global health, and it's a critical reimagining of ourselves in relationship again to each other and to our biosphere. And with that, I will end my talk. Thank you, Tenzin.
Thank you so much, James, for that very insightful presentation. And I encourage the participants to put their questions, perhaps briefly, in the chat box. But to get us started, James, one of the things that we have come to recognize as a civic society is the politicization of pandemic and response mechanisms. You talked about fake news as sort of another pandemic, so kind of dealing with two pandemics simultaneously. What would you advise government bodies and also ordinary civic citizens in terms of how should they observe and respond to such behaviors, which is simply breeding distrust and polarization, in terms of how we could collectively act against such pandemics?
Yeah, it's a big question, Tenzin, but I think I'll just be as simple and clear as I can be. I don't think there are collective insights and collective aha moments and collective convergent policy frameworks. I think this is an ideal, but I don't think it actually exists. I think we're close, that there's a process that gradually leads to or moves in that direction. And this is, I think, partnerships, quote unquote, of the willing around particular policy goals. That's the way forward. That's the way human beings have always moved. It's always, one, some, a few converge and others join and so on. The issue you raised around fake news, this is a fundamental issue. in the sense that it challenges the very notion of liberal democracy is being challenged. Liberal democracy is really predicated on the idea of an informed and a judicious citizenship, citizenry that are aware in varying levels, but are aware of issues that and they engage in a public policy process through a variety of means. It's not all based in fancy rooms with mahogany walls, but through various means. The public dialogue is critical to liberal democracy, and truth and objective fact is fundamental to that process. And so we can, as we very famously have heard, we are free to choose our opinions, but not our facts. What is a fact and what is not a fact? This is really at risk. And not only, it's very floridly at risk. And so the counter to that must be, at least in my view, it must be really bringing people back into the responsibility for their own participation in their political space and the consequences of that, right? So the choices that you make, it's not just about sort of perpetual liberty and freedom. You have liberty and freedom to pursue certain things, but there are consequences to that, good and bad. And so seeing this and addressing this problem is not an easy challenge. And I've talked about complexity theory and artificial intelligence, machine learning, and so I don't think it has anything to do with that. The issue you've raised. This is really fundamental in the sense that we need ourselves to be aware and responsible for our awareness. And this is a very consistent, I think, with the Dalai Lama Center for Ethics and Transformative Values. It is about being responsible for your understanding. And now, how does that happen? It requires guidance. It requires nurturing. It requires skills. There are very specific skills that are associated with this, but it also requires encouragement. And this is where I think, the advice that many people are giving governments now, myself included, is it's very important that you put your scientists out there and you describe, you don't just declare, but you describe the rationale for certain choices, that you describe and you very clearly recognize and you articulate that these choices, these are imperfect and they're based on the best evidence and understanding that we have today. And that will change tomorrow as we observe, as we learn, as we more carefully understand the causes and conditions of, for example, COVID. And that's a kind of a gradual educative process. And it's an educative process by example. And it's also one that includes people in the process of knowledge and understanding. And it also is one that acknowledges their ability to understand and therefore to take appropriate action. In other words, to comply with appropriate public health directives. So it's a very complex question, Tenzin. And I will say that the last thing I'll just say on it is that there are many people who've thought a great deal about this, far more than I have, for many, many years. And they're actually proposing, one of the things that's, I think, actively being discussed in the United States, for example, is a CDC, a Center for Disease Control like organization for public information and for public knowledge that would encourage critical analysis, critical awareness, right? And help people develop and maintain the tools for critical analysis and critical engagement with facts, with what is necessary for meaningful policy debate and political choice.
Thank you. I think, one of the challenges as we are facing here, even at the center, is because primarily our work is around nurturing ethical imagination, and the idea of how philosophies and frameworks such as Ubuntu can actually drive policy making, and that is one of the gaps that actually we do sort of see in civic society a fair amount. One of the things that, James, you mentioned about is the need for stories, new stories. What we are also seeing is too many stories. Right. There are quite a bit of false narratives. There's a lot of virtue signaling that's happening in stories that perhaps at one point was simply limited to Wall Streets. Then it came to Silicon Valley and variety of tech industry. In your own experience, as you have been, not only a scholar, but a practitioner, trying to fight the healthcare crisis of a generation. We are seeing a lot of private philanthropy with good intentions, perhaps, trying to work with governmental agencies and different groups and so on. What would you advise to such large, private, wealthy individuals about what should guide their decision-making and choices around cooperation and collaboration in such times?
Again, and a great question. There's so many elements to it, so many assumptions and so many premises that it would have to carefully illuminate before deciding on an answer. But let me just jump to an answer. Excuse me. Philanthropy is the choice of an individual or a small group of individuals who have the power of that choice and who have the resources at hand in order to implement their choice. Now, that didn't happen by spontaneous generation, to go back to Pasteur. That didn't just happen by magic. There are very particular causes and conditions that have led to that circumstance where a person has wealth in excess of what they need, and sometimes extreme wealth, and where many other people don't. And as I've alluded to, and as I'm sure you've alluded to in previous talks, this is a threat. This is a threat to our political systems now. So I think the first thing I try to do when I talk to people who have such wealth and who are philanthropic, and that in itself is also very special. Right? It's not a universal phenomenon among wealthy people. It's a small number of people who are willing and able to be philanthropic. So it's a very precious thing. It's not to be dismissed, but it's to be understood. The first thing that I try to do is really help and describe that they are not independent, of the past, the present, and the future. That what they do will matter, and therefore do and choose carefully. And so I think it's almost implicit in what I've already said, what my next statement will be. If you have very significant wealth, for example, the Gates Foundation, working with existing public sector institutions that are massively under-resourced, and I'm talking about the WHO, for example, and enabling and working with them and making sure that the priorities of your foundation are at least consistently in dialogue and coherently related to the priorities of a public institution whose responsibility, whether they want to or not, it's not their choice, it is their responsibility. Their responsibility is to ensure the health and wellness of all, right? For example, in the case of the WHO. Therefore, their priorities and how they've approached their priorities are very, very different than the way in which a private sector corporation, for example, would approach their priorities. They're very self-interested. If the wealth of an individual comes from or is held, comes from a private sector orientation, the orientation is different. Now, I'm not saying that it's wrong. I'm saying that there must be a relationship, and the determination of priority, the determination of giving, the determination of support, and so on, is really rooted in these kind of phenomena, these kind of realities. And they must be considered if you're going to actually contribute meaningfully to not just immediate relief of suffering, which is always, at least in my view, always the first priority, but also contribute to the long-term amelioration, if you will, of the causes and conditions that have created that suffering in the first place. So I know it's a very general approach, Tenzin, but I think there's a lot of philosophical and important principles in what I've said.
Thank you, James. We have a question here which alludes to this very realistic condition that what do you say about the risk that theories like complex systems can discourage people from thinking about actions or solutions for crises like protection of refugees? That oftentimes, not only civic groups, but even governmental agencies, UN, I mean, many of them cite complexity as a reason for inaction.
Yeah, so I mean, I'm not using complexity as an obscuring concept. I'm not trying to make it more cloudy, and that I think when people do cite complexity, oh, it's complex, it's what they're doing is they're clouding, muddying the waters, making the waters very, very cloudy so you can't see clearly. When I talk about complexity, I'm talking about complex adaptive systems theory. It's a very specific scientific paradigm or a very specific approach to understanding objectively the nature of reality, and also doing so with a view primarily, and this is what I really tried to emphasize, for anticipatory action, right? So complex adaptive systems theory, and when I talk about complexity, that's what I'm talking about. It's about critical problem solving for action, not for armchair philosophy and for muddying the waters. It's for actually ensuring that your tools, the tools you use to help people in extreme circumstances, are better, they're more effective, they're focused on equity, and in other words, on the most vulnerable people. If you can't help the most vulnerable people in an extreme situation, then you're not doing what I'm suggesting what needs to be done. That's the first priority. And so what I'm talking about is use of complexity theory, complex adaptive systems theory, for anticipatory action that is effective, that is equitable in its orientation, that seeks to assist the most vulnerable, and that is excellent, that seeks excellence in its constant application to improve and get better and better and better. That's what I'm talking about.
Thank you, James. We have another question from the audience. Given the epistemological shift effects of climate change on the environment and growing inequality, as you so elaborately presented on, could you comment on how important management of chronic conditions will be in the scheme of future global health and health system challenges?
Yeah, it's a very good question. And particularly so as there's a whole range of chronic diseases, occupational disease, diseases of aging, and diseases of so-called lifestyle, a term I've never liked, as if everybody gets to choose how they live their life. Not everybody does. So for example, obesity, diabetes, or now what's called diabesity globally. There's no question that there's also globally a huge epidemiologic shift, so that there's a massive increase in chronic disease now in the global south. And this is really a consequence of the way in which the global south is now essentially organizing itself within a global economic and political system. And so there's a huge shift in the pattern of disease. And this we ascribe to the social determinants of health, which actually account, if you look numerically, we know that only about 30% of causality for any disease can be specifically described in terms of an agent, an external agent, a microbe, a contaminant, a way of work, and so on. But 70% of causality is actually ascribable to the societal determinants of health, right? To the way in which society is organized around wealth, around access to healthcare, around access to healthcare technologies, and so on and so on. So chronic disease, the massive increase in chronic disease in the global south and in the north, but very specifically in the global south, is a consequence of that huge change in the way that human beings live, work, play, organize themselves, and also a consequence of how we interact with our global biosphere and planet. So this requires equal attention, right, in terms of how we think about global health and global health interventions. And I've only emphasized infectious disease for the sake of simplicity. And in a 30-minute presentation, you can't talk about everything. So I've emphasized infectious disease, but in doing so, I've emphasized, for example, in Malawi, the importance of the social conditions, right, and how these are really determinant, and 70%, in fact, determinant of the phenomenon of disease of schistosomiasis, for example. So I think it's a great question, and I hope in my brief answer I've tried to illuminate how important that question is, and it does require equal attention in terms of how we think about the future.
Thank you, James. Perhaps being mindful of the time, one last question. Given your wealth of experience in various domains, what gives you hope today, knowing all that you know about the world and human behavior?
It's a great question. I had a great chat before we actually came online for the people now that are here. I had a great chat with Javier, your colleague, and we were just talking about children. As you know, Tenzin, Javier has 2 children, and 2 boys, a 4-year-old and 7-year-old. I have 3, and an 18-year-old soon, in a couple of weeks he'll be 18, a 16-year-old and a 13-year-old. And we were talking, and I was just something about the conversation. It just caused me to see that the greatest, for me as a human being, probably the greatest joy of my life thus far, and who knows what tomorrow will bring, but the greatest joy of my life thus far is in being a father and being observing and seeing and rediscovering, frankly, the beauty of the world through the eyes and the experience of my children, and walking and being with them in a very particular role. I'm not a best friend, I'm a dad, that's my job. But in a very particular role, being with them and walking with them in their journey, and also learning through them and through the joy of being and the joy of living in that incredibly beautiful space of abiding joy. This is its own good, and it's not something it's not something that you can't control it. You can't bottle it up. You can't turn it into a product. You can't it's something. It's an experience of being. And it is, I think, in essence, what I was trying to get at with Ubuntu and with referring to Emmanuel Levinas. There's something there that is just so profoundly, utterly, transcendently beautiful, that it has its own good, its own meaning, and that's worth living for. you know? And it's worth discovering and helping others, enabling others to discover that beauty. And we are capable of this as human beings. And we have done so many amazing things as human beings over human history. We've done some terrible, terrible things, and I've seen a lot of them. We've also done some very, very bad things, but it's our choice. And we have, if we can literally wake up, and this is your business, Tenzin, this is what you do. If we can literally wake up to see that beauty, that is hope is just another word for that, you know, is what I would say. Yeah.
Thank you so very much, James, and thank you all for joining as we wrap up this round of the Reimagine series. I do hope that through different presentations and interactions, you will personally find something to reimagine in your own life, and perhaps counter some of the complacency in your own behaviors, in your own mindsets, and push yourself to make a positive change, not only for yourself, but for people around you as well. James, thank you so very much again for joining us this morning.
Thank you.
And we look forward as a center to continuing this conversation and work together.
Thank you. And thank you, Javier and
Natasha.
Natasha, for your help in putting this together. Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Stay safe and healthy.
Yes, you too.